Good afternoon, everyone. My name is Bijan Kimyagar, and I am the Associate Executive Director for Research at Citizens Committee for Children of New York. For those of you joining one of CCC's webinars for the first time, welcome. A brief introduction to all of us at Citizens Committee. We are an independent and nonpartisan child advocacy organization. We advance well-being, equity, and justice for all New York's children through research, advocacy, and civic engagement. This means we combine public policy research and data analysis with citizen action to engage policymakers, service providers, and the public at large to promote practical solutions that ensure every child is healthy, housed, educated, and safe. Today's webinar provides an overview of our recent report, The Youngest New Yorkers, Building a Universal Early Care and Education System in New York City. The report summarizes a wealth of information about the public early care and education system in the city that we have gathered over the past year in partnership with a coalition of stakeholders. We have requested and analyzed data on enrollment in early care and education programs from the Department of Education. They administrate school-based settings as well as contracts with center-based and family childcare providers. We have also requested and analyzed data from the Administration for Children's Services, which facilitates access to subsidized childcare. We also spoke with dozens of childcare and early education providers at both center-based and family childcare settings. They shared their valuable insights to barriers that families face accessing public programs, as well as challenges they themselves face operating their programs and sites. This includes, among other issues, a backlog of payments that the city should have been giving them for years for services they've already provided. And CCC has been advocating alongside our coalition partners on this and other issues and making progress towards resolving them in partnership with the city. We also spoke with parents of young children in listening sessions and used what we learned to develop and launch a citywide survey of parents to hear from even more people about their childcare needs and experiences. Importantly, we also wanted to hear about their solutions to how to improve access to programs. We will drop a link to the report in the chat, specifically our interactive publication page where you can download the full publication or view sections of it. On our online database, data.cccnewyork.org, you may also explore hundreds of indicators on child and family well-being in New York City, including several findings from our analysis of administrative data on early care and education enrollment, capacity, and also child care affordability. I want to remind all of you who joined us that while you may be muted during the presentation, you are essential to the conversation. Please put your thoughts, comments, and your questions in the Q&A form. We will address them after the final speaker. I also encourage you to join our e-Action network to receive updates on our data resources, our advocacy, including actions you can take today to advocate for a universal early care and education system in New York City. Please also engage with us on social media. We are on Twitter, Facebook, and Instagram at CCC New York. Today, I am joined by three of my colleagues at CCC, Rebecca Charles, Policy Associate, Maria Drobniak, Senior Research Associate for Data Resources, and Christina Onea, Research Associate. They will also introduce themselves at the start of their portion of the presentation. Following a brief overview of the year-long project that I will share with you all, we will hear from Maria, who will share highlights from her analysis of administrative data on enrollment. We will also hear from Christina, following Maria, of reviewing the findings from our experiences speaking with parents of young children. And we will also finally hear from Rebecca. She will be our final speaker and will go over CCC's policy recommendations for building a universal ECE system. And just as a note, we use ECE as an acronym for early care and education, and you will hear us use this acronym multiple times during the presentation. Some background on this work. As I mentioned, it was a year-long project, and our goal was about systematically analyzing public data to elevate and also elevating the experiences of parents and caregivers alongside ECE providers to identify actionable solutions that increase utilization of New York City's early care and education system. We have found, based on data, that the system is underutilized, but we know, given the high need for childcare and early education programs, the high cost of childcare and early education programs that are not public, that underutilization does not equal a lower need. And so we're sharing findings to increase awareness around what are the barriers, knowing that if we increase access to early care and education programs, that this has positive benefits for child development, as well as parental employment stability, and thereby it builds economic security over generations for families. The project has been going on for over a year, and while we started with looking at the public data to inform how we proceeded, it was really early care and education providers who were our partners throughout this process, helping us interpret the data that we were analyzing, helping us shape the research questions, and really plan for outreach for speaking with parents of young children. We spoke with parents of young children in the summer of 2022, and this helped us prepare for and launch a parent survey later in that year, but not before sharing back some of the initial findings with the providers themselves and others in city government, for example. Following the parent survey, which closed in February of this year, we also shared back findings with the providers, with the people who participated in the survey, and with city agencies to inform their work that is currently ongoing, as well as city council's work that's currently ongoing. And we're now moving into a new phase of this work, building on the last year, to really make sure that the implementation of these ideas, these strategies, these solutions are done in partnership with providers, because they really are the backbone for this system, and they have a lot to share in terms of what's possible and being creative about implementing solutions. With this, I'm going to pass the baton to my colleague Maria, who will share highlights from our analysis of data on enrollment.
Thank you, Bijan. Hello, everyone. My name is Drobnjak Marija, and I'm very excited to be here today and walk you through a couple of slides on the key findings from administrative data analysis. I would like to invite you, as Bijan already said, as you're seeing all of these slides and all the data, think of them in combination with your own experiences with the EC system, and also in combination with all of the findings that we present throughout the presentation as a whole, including parents' perspectives, providers' perspectives, policy components, because I think that's the only fair way that data should be analyzed and thought of. So I would like to start us off just by highlighting like something that really is important, that New York City has made historic investments in public contracted early care and education programs. So we see that from school year 2012-13, when we had around 33,000 children under 5 in the contracted part of the system, we are now ending with the school year 2021-22 at 94,500 children being in the system. One data fact that I will share, and it is not on a chart, important to keep in mind that like over 3/4 of seats available in a contracted system are school day, school year, and I'll talk about that in a bit. But for now, to focus on the blue part of the chart, it's really showing the expansion of pre-K, which took off in 2014-15. At some point at its peak, it served almost 70,000 4-year-olds, which is great. The bottom part of the chart, the lighter blue, is really capturing early learn system, like historically called early learn, including infants, toddlers, and 3-year-olds up until school year 1920. In that school year, all 3-year-olds that were in that kind of part of the chart are actually being called a 3K. So City introduced pilot 3K in 2017-18, which increased over time. And in 1920, pre-pandemic, it served around 17,500 3-year-olds. We see that during the pandemic, enrollment declined across all age groups. And we also see that after the pandemic, we have number of 3-year-olds doubled, like we served like in school year 21-22, 34,000 3-year-olds. However, enrollment for 4-year-olds continues to decline with 56,000. And one important takeaway here is also that the share of infants and toddlers being served in a contracted part of the care is really the smallest. And we will talk about that in a bit. And now on the next slide, what I'm comparing here is really children enrolled in contracted care and the vouchers, which really comprise what we call all publicly funded system. Before the pandemic, that part of the system served, all publicly funded systems served 127,000 children under 5. In school year 21-22, it served around 117,000 children. We see that enrollment in contracted care came back to pre-pandemic, and even increased to 94,500 children. However, children using vouchers for childcare decreased, and as ACS is describing, that trend in MMR is really because the population eligible and using cash assistance decreased, and they are by default eligible for childcare. So while we keep in mind this figure of 127,000 children under 5 in all publicly funded system pre-pandemic, we can go to the next slide. We want to think about that number compared to all children under 5. And we know that we have almost over 500,000 children under 5 in the city. So if you focus on the left part of this complex chart, we can see that over 200,000 infants are in the city, 106,000 toddlers, and then we see 108,000 3-year-olds and 106,000 4-year-olds. So that is the whole population of children. However, children enrolled in publicly funded system is mainly fueled by 4-year-olds and 3-year-olds. Close to 74,000 4-year-olds, 30,000 3-year-olds. And another key takeaway is really a very small share of infants and toddlers being in the system. And these are children using both contracted seats and the vouchers. And I would like to spend a little bit of time diving deeper into infants and toddlers because their enrollment process is kind of different than those for 3 and 4-year-olds. So we can go to the next slide. And here I would like to first say that for infants and toddlers to be able to use any of the publicly funded seats, they have to be eligible. They have to be in households who are income eligible, and there are other criteria. So thinking about that universe, this was data for 2018 and the 19th, 91% of infants and 70% of toddlers who are in potentially income eligible households were not enrolled in publicly funded care. And that is stark. So I'll focus here on this left pie on infants just to unpack it a bit. So we start from over 200,000 infants in New York City. Then this part of the pie that is blue shows number of infants in household that are income eligible under 200% FPL, federal poverty level. For family of 4, that would mean in 2019 dollars around 51,000. So with expanded eligibility criteria, we have an additional 28,000 infants being eligible. And now that it translates to around 77,000 for a family of 4. Just think about these dollar figures if you're thinking what are the needs of families and all other expenses they have. So we have over half of infants being income eligible. And now if we move on to this bar to the right, we see that in 2018, close to 8,000 infants were enrolled in a system, while 85,000 were not enrolled. So that is that 91% who are not enrolled in a system. And while we are here, I want to say this is the data, so before the pandemic. Right now, as of school year 21-22, if you focus on the next slide, we can see that number of infants and toddlers in the publicly funded system further declines. So it went from 22,748 down to 13,000. And 2 bars below are showing children using vouchers and contracted. So we see the decline happened across all components of the system, both children using the vouchers, both those enrolled in contracted infant seats. And we will talk about those in a bit more. So now moving from that kind of focus on infants and toddlers and coming back to that fact that I mentioned in the very beginning that over 3/4 of the contracted system are providing school year seats. We see on this chart here that trend has been the number of these seats has been increasing. So while the city has added capacity, which is great, it mainly was able to provide this type of care, which provides 6 hours and 20 minutes a day, 180 days a year. It does not include summer. It does not include holidays. So just thinking about that form of care, while very important and valuable, it does not really match even the basic working hours, 8 to 10 hours. On the other side, we have extended day year-round seats that provide care 8 to 10 hours a day and throughout almost the whole year, either 225 or 260 days. So this is more in line with what really working parents need to cover their work hours. And in this chart, we're not even capturing the parents who might need care outside of these traditional hours. So while this chart is capturing capacity as a school year 2021-22, I want to also add that in between these 2 years, so throughout the pandemic, both family providers and center-based providers entered a new contract with the city. And both of these new contracts really added almost exclusively school day seats. Center-based providers got like 12,000 of those seats. Family-based providers got 3,000 school day seats, while the number of full day seats declined. And like we should keep this in mind as we are kind of seeing the next couple of charts on open seats or those seats that are not being used by parents. So we can move on to the next slide. And here I'm coming back to that, and you've probably been hearing a lot about these conversations, but so there were thousands of open seats prior to pandemic, around 21,000. And that number increased after the pandemic, and in school year 21-22, we had around 32,000 open seats. We see also that enrollment increased and capacity, if you see on the left, the capacity in the system increased, as I mentioned. Family and center-based providers entered new contracts, so we have more seats available to serve the families. And on the next two slides, we are really unpacking this further. Okay, we know there are open seats. We know that we should be thinking about them in addition to everything that my colleagues will share after. What are the challenges on the side of the providers, on the side of parents? But I want to also draw our attention that centers continue to have the largest number of open seats. So on this slide, which has a lot of data, we are showing 2 school years, 1920, and 21-22. Darker blue is 1920 and the lighter blue is 21-22. And then it's breaking down by family providers, schools, and centers. So if you just focus down at the bottom of the chart, we see that pre-pandemic centers had around 13,000 open seats. School year 21-22, they had around 17,000. This really prompted our project and really our focus to unpack, while we see that on a school side, especially prior to pandemic, we don't have a lot of unused seats. So it really prompted us to think like what is happening in centers and also in family child care providers compared to schools. However, after the pandemic, we also saw that number of open seats in schools that doubled. So there is a lot to unpack when we talk about open seats. On the right side of the chart, you also have total capacity in each setting across both years. And another data point besides focus on centers and family providers is how open seats kind of break down by age groups. And we see that it's on the next chart that majority of open seats are among pre-K seats. And also we are kind of having in mind that majority of pre-K seats are school day, school year. So we see that number of pre-K seats increased from 30,000 to 16,000. On the 3K side, you can probably see that across both bars, enrollment and open seats and capacity, all the seats has doubled, like everything has doubled. Enrollment increased, open seats increased, capacity increased. So we are saying that 3K trend is pretty much the same across both years. And there is something I want to say here about infants and toddlers. We see that, I would say like infants and toddlers combined, we have around, prior to pandemic, around 63% of those seats were used. After the pandemic, around 36%. However, the trend, the data after the pandemic, the data we got from the DOE does not allow us to unpack the trend between infants and toddlers. But prior to pandemic, we know that toddler use of the seats is pretty much in the same vein as pre-K and 3K, around 70–80%, while infants seats were not used as much. It was like 16% before the pandemic. And there are obviously many answers to why this might be the case, but also keeping in mind that really all budgeted capacity is the smallest for this age group. And I will end this section really drawing our attention. You have some of these key findings. There are great investments. System is serving 3- and 4-year-olds. The largest number of unused seats are among pre-K seats and center-based programs. We know that infant seats are not as used. Family care providers are also experiencing low use of seats. However, as Bijan already said, low utilization of seats that does not mean the low need. And there are many more answers that will kind of explain these trends that you see in the data, as my colleague Christina is presenting. So thank you, everyone, and I'll pass it on to Christina.
Thank you, Maria. Hi, everyone. My name is Christina Onea, and I work mainly with the parent-focused data of this project. As Bijan mentioned at the start, the second important component of this work is our collaboration with parents and caregivers, starting with our listening sessions held last summer. We had held 12 listening sessions with 162 parents in New York City. We recruited through our partners and chose to focus on geographic areas based on the analysis of the administrative data that Maria just went over, though we did have representation from all boroughs. Most parents we spoke to in these sessions had children enrolled in center-based care, family child care, or DOE pre-K, and about 10% did not have a child enrolled in any ECE program. We were very interested in reaching parents not currently enrolled in a program to better understand the barriers that keep them from enrolling. We thematically coded these listening sessions and found that 4 key themes emerged. These are access, which encompassed difficulties with location, transportation, hours of care offered. Communication included a desire for better and more communication with providers and more information about navigating the ECE enrollment process. Cost included already present financial strain and concerns over rising costs of care, and health and safety, in which parents and caregivers raised concerns about their child's health and safety and care, including concerns about COVID, site security, and trust in providers. These themes helped to inform the questions we asked in our citywide survey of parents, which was an SMS cell phone-based survey through text messaging. This allowed parents to participate on their own time and pause or come back to the questions at a later time as needed. We recruited via flyers and had all parent-facing materials, including the survey and the flyers, available in 4 languages that were suggested by both providers and partner organizations and parents. And these languages were English, Spanish, Chinese, and French. 2,700 parents and caregivers began the survey. 1,800 met eligibility requirements, and 1,100 completed the entire survey. Through the survey, we found that parents' most important considerations for selecting care aligned well with the themes that came from the listening sessions. The top selected answers included health and safety, cost of care, location and transportation, and communication with providers. We also found on the next slide that the most effective way for parents to learn about childcare is through a recommendation from family members or friends. This speaks to the desire for a well-informed and trusted messenger for all parents to learn about ECE programs and locations. When we asked parents about the supports that they need, parents selected more time with my child or mental health supports as the most important. This was also corroborated by providers in our partner organizations who suggested that the best attended programs and events were ones where parents could spend time with their kids. On the next slide, we can also see that nearly 80% of parents trust their children to be taken care of by a provider as early as 1 or 2 years of age. The current ECE system prioritizes seats for 3- and 4-year-olds, leaving parents with younger children who do feel comfortable leaving their children in care with fewer options. Many parents also reported needing regular care during the week for most of the day. The current system capacity does not provide enough support for this number of hours, and this suggests that we need more extended day programs to meet parents' currently unmet needs. And speaking of these unmet needs, on the next slide, we can see that about 40% of parents employed full-time need regular care during evenings, overnights, or on weekends, and 31% of working parents part-time need this care as well. Currently, however, no public program is contracted to offer these hours. Parents are also split between needing care close to home and needing care close to work. While many need a provider close to home, a significant share would like a provider closer to work, and this really points to a need for variety when it comes to where locations are for care and where they should be offered. And while parents have all these unmet needs, we can see on the next slide that they also lack information and knowledge about how to alleviate some of these needs through subsidized care. Unfortunately, more than a third of all our respondents did not know about subsidized care programs, but those who receive benefits were more likely to know. A quarter still did not, even though they're likely eligible for these resources. Among those not receiving benefits already, 50% were unaware of the existence of subsidized care options. The parents who have tried accessing subsidized care reported a range of experiences in the enrollment process. The barriers they cited most often included access issues, such as a need for guidance through the process, or that the process itself was time-consuming and stressful, including the stress of gathering documentation and ensuring that it is done correctly. On the next slide, we'll see that 75% of survey respondents reported using strategies to mitigate the cost of childcare. Most reported reducing household expenses, and a smaller number made changes to their childcare arrangement in one or more ways. And we found that households with higher incomes were more likely to borrow money from family or friends and to make use of their personal networks, whereas most lower income households rely on cutting spending. To summarize, we need to make sure that providers are equipped with what they need to support parents and connect them to services and help them enroll in programs. There needs to be more capacity built for care, especially for parents of children younger than 3 and 4, and parents who need more hours of care, even those that are not currently offered. We also need to ensure parents have the information they need to know about subsidized care to alleviate cost fears and how to navigate the enrollment process in those programs. And that's it for this data portion of the presentation. So I will pass it back to Bijan.
Thank you, Christina. I would just like to remind everyone that there will be a Q&A after the presentation following Rebecca, who's going to be going over policy recommendations next. Please use the Q&A to ask any questions that you might have about the data and also about the solutions that we'll be developing and that we've been developing in partnership with partner organizations and with parents' feedback. Rebecca will bring us through walking through the CCC's recommendations. Rebecca.
Thanks, Bijan. Just making sure everyone can hear me okay.
Yes, we can.
Okay, great. I am a policy and advocacy associate with CCC. My name is Rebecca Charles, and I cover our early care and education portfolio as well as our K-12 portfolio. I'm just going to be walking you through the policy recommendations that not only we put together as a result of this report, but also some of the recommendations. The report brought out some of the recommendations that we've already had as an organization, as well as with partners through the Campaign for Children. So our first recommendation is we want to protect investments in 3K. Many of you may have heard that in last year's budget, 3K was cut, and there was a $500 million cut to 3K, and that was put forth in this year's preliminary budget, which means it can still be restored in this budget season, but we really need to act on that. That $500 million cut will immensely stall the progress of 3K and the expansion of 3K to universal, which was the original plan for 3K. We also want to leverage these open 3K seats that you've been hearing about today in our webinar to meet demand for ECA programs for children 3 years of age and younger, so infants and toddlers. And we want to do that by converting school day, school year seats to extended day year-round options to really ensure maximum utilization of seats. As you've heard here today a bit, a lot of parents aren't using the seats that are in their area because they simply don't meet their needs. Many parents need seats that cover hours and aren't just within the 9 to 3, 8 to 4 range. They need either overnight care, they need extended hours, and they also need hours during the summer because a parent doesn't stop working just because their child is no longer in childcare and the school year is done. So they really need care all year round. So we really want to focus on making sure we meet the needs of community members, and what community members are saying they need are hours extended and hours that meet their schedules, and every family and parent has a different schedule. We also want to offer greater flexibility in center-based and family child care provider contracts. A lot of our providers within the city are through community-based organizations that are contracted by the city, and we want to make sure that their contracts allow for this flexibility to meet the need for extended hours and infants and toddlers. Christina and Maria a little bit mentioned the importance of access in terms of communication with families and language access. That's a huge barrier right now in the childcare space. So we really want to build a robust, culturally and linguistically supportive education and engagement campaign at the community level. This would increase public knowledge and utilization of all public ECE programs. One of the big takeaways from the report was that parents across the city didn't even know that there were subsidized childcare options across the city. Hundreds of languages are spoken in New York City, and we also want to make sure that families who might not have English as their primary language are able to access not only subsidies, but find providers and fill out these applications and get care. We also support decentralized enrollment options so that providers can enroll children and families who apply for care directly and on site. So that means right now there are, like I said, community-based providers within the ECE space. And what happens is that a family comes to them and says, I want my child to get care here, but the provider then has to send them through the DOE to apply for care and get approved. And oftentimes that leads to the family not getting the option they wanted, not getting the provider they wanted. And there's a huge delay because it's all going through the DOE. We want to be able to entrust providers to enroll their own students. They know what the community needs are and they know their communities. And we want to be able to give them that agency to directly enroll families if that's what they choose to do. We also want to facilitate information sharing and parent access to Fair Fares transportation subsidies. Fair Fares, as many of you may know, is a program for low-income New Yorkers to access the subway MTA fares at a lower rate. And a major barrier to childcare was not having transportation. So we want to make sure that all information about Fair Fares is accessible and out there. And we also support legislation that would expand the Fair Fares program. Next slide, please. Thanks, Bijan. We want to advance the next stage of salary parity for the center-based workforce. So in 2019, there was a salary parity win for contracted centers, but that left out a lot of people. It left out center directors and support staff, and those people are obviously playing a major role in these contracted settings, and they have the same exact jobs in many cases as their DOE counterparts, yet they're not paid as much. So we want to ensure that longevity is factored into their parity agreements and salary increases, and that as a minimum wage floor of $25 an hour is established for all support staff. We also want to ensure that home-based family child care providers benefit from the increased state market rate. That market rate was increased last budget season at the state, and we also want to make sure that they benefit from any kind of state increases that are coming down. Family child care providers are just often overlooked in this space, and we want to make sure that they're receiving everything that they are granted from the state. And then lastly, we want to improve connections to the early intervention program and behavioral health services within ECE settings. Early intervention is a program to identify the need and services for children with disabilities who are under 3. And so it's a very, very crucial program because, as we all know, ages 0 to 3 is just a very important time to catch things like that and to address the needs of a child. And so we want to make sure we're improving access to the early intervention program. And then lastly, we have a take action on our website. We're going to also post this link in the chat, I believe. This take action, yep, okay, it's right there in the chat. This take action is basically, if you fill that out, it will go to your city representatives as well as other city leaders, calling on them to take on these policy priorities that I've just covered today. So we would really appreciate your help in making these policy priorities come to fruition. And we thank you so much in advance for your action.